COPD, a complex disease with varying symptoms and causes. Chronic obstructive pulmonary disease, COPD, is a progressive respiratory condition that affects millions of people worldwide. According to the World Health Organization, WHO, COPD is the third leading cause of death globally, with an estimated 3 million deaths annually. Despite its prevalence, COPD remains a complex and perplexing disease that challenges physicians and researchers alike. COPD is a disease of the lungs that causes difficulty in breathing, persistent coughing, and mucus production. The primary causes of COPD are smoking and exposure to environmental pollutants such as fumes and dust. However, genetics and other factors may also play a role in the development of the disease. One of the most perplexing aspects of COPD is the variability of symptoms and disease progression among patients. Some patients experience mild symptoms that do not significantly affect their quality of life, while others experience severe symptoms that interfere with daily activities and require hospitalization. COPD is typically diagnosed through a combination of medical history, physical examination, and pulmonary function tests. Pulmonary function tests, such as spirometry, measure the amount of air a patient can exhale forcefully in 1 second, FEV1, and the total amount of air a patient can exhale, FVC. These tests provide valuable information on lung function and aid in determining the severity of the disease. There are 4 stages of COPD, ranging from mild to very severe, based on the results of pulmonary function tests. Treatment options for COPD vary depending on the stage of the disease and the severity of symptoms. Treatment options include medication, oxygen therapy, pulmonary rehabilitation, and surgery. Medications for COPD include bronchodilators and corticosteroids. Bronchodilators are medications that relax the muscles around the airways, making it easier to breathe. Corticosteroids are anti-inflammatory medications that reduce swelling and mucus production in the airways. Oxygen therapy may be necessary for patients with severe COPD to improve oxygen levels in the blood. Pulmonary rehabilitation is a comprehensive program that includes exercise, breathing techniques, and education on COPD management. Pulmonary rehabilitation can improve lung function, reduce symptoms, and improve quality of life. In some cases, surgery may be necessary to remove damaged lung tissue and improve lung function. Despite these treatment options, COPD remains a challenging disease to manage. Patients with COPD often experience exacerbations, or periods of increased symptoms, which can lead to hospitalization and even death. Exacerbations are typically triggered by infections, such as pneumonia or the flu, but can also be triggered by environmental pollutants or other factors. One of the most perplexing aspects of COPD is the significant variability in the rate of disease progression among patients. Some patients experience a rapid decline in lung function and a significant worsening of symptoms, while others experience a much slower progression of the disease. This variability makes it challenging to predict disease outcomes and develop effective treatment strategies. Research into the causes and progression of COPD is ongoing, with a focus on understanding the underlying mechanisms of the disease and identifying new treatment options. One area of research is the role of genetics in the development of COPD. Studies have identified several genetic mutations that increase the risk of developing COPD, including mutations in genes that regulate inflammation and lung development. Another area of research is the role of environmental factors in the development of COPD. Exposure to pollutants, such as cigarette smoke and occupational dust, is a well-established risk factor for COPD. However, recent research has also identified other environmental factors, such as air pollution and indoor cooking fuels, that may contribute to the development of the disease. In addition to these factors, researchers are also investigating the role of the microbiome in COPD. The microbiome refers to the community of microorganisms that live in, and on the human body, including the lungs. Studies have shown that changes in the lung microbiome may contribute to the development and progression of COPD. One of the challenges in studying COPD is the burstiness of the disease. Exacerbations can occur suddenly and unpredictably, making it difficult to monitor and manage the disease. Researchers are exploring new methods of monitoring COPD, such as wearable technology and telemedicine, to improve patient outcomes. Despite the challenges, there is hope for patients with COPD. New treatment options, such as biologic therapies that target specific inflammatory pathways, are being developed and tested in clinical trials. These therapies may offer a more targeted approach to treating COPD and may improve outcomes for patients with the disease. In addition to medical treatment, lifestyle changes can also help manage COPD symptoms and improve quality of life. Quitting smoking, avoiding exposure to environmental pollutants, and engaging in regular exercise are all important steps in managing COPD. Eating a healthy diet and maintaining a healthy weight can also help improve lung function and reduce the risk of exacerbations. In conclusion, COPD is a complex and perplexing disease that poses significant challenges to patients, physicians, and researchers. The variability of symptoms and disease progression, as well as the burstiness of exacerbations, make it difficult to predict outcomes and develop effective treatment strategies. However, ongoing research into the underlying mechanisms of COPD and the development of new treatment options offer hope for patients with the disease. By managing symptoms through medical treatment and lifestyle changes, patients with COPD can improve their quality of life and reduce the risk of exacerbations. Thank you for watching. We hope that we have expanded your knowledge somewhat. It would be awesome if you would join us, comment, like and subscribe. See you next time. Have a great day.